Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? I'm Dr. Sajan, and this is Clinic Talk on the Plastic Surgeon Podcast. Welcome to the Plastic Surgeon Podcast, where we listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand the motivations of why they would risk their life under the knife. I'm Dr. Sajan, and today is Clinic Talk with CEO of realdrseattle, Sabrina Sajan. Sabrina, how's it going?
It's going great.
We have a real wild story today about a terrorist sting operation that happened in the office. Is that right?
Yes. So this was a few months ago. We had a patient come in and they scheduled a consultation and they had
And it was with the other doctor in her practice.
Correct.
So I heard about all this on the side.
Yes. This appointment was with a different doctor. That's part of our practice. And this patient came in for a consultation for a facial consultation.
He wanted a rhinoplasty, right?
Yes.
A nose job.
Correct. So he wanted a rhinoplasty, and then he also wanted to remove this significant scar that he had on his face.
And I was talking to the other doctor, and he told me that consult was weird because a patient specifically requested to look different.
Yes, the patient wanted to do multiple surgeries quickly, and he wanted to do these because he said he wanted to look different. That's correct.
And people come here wanting to look different, but I remember he asked to have a different face and be unrecognizable. And that's what he was meaning by different, because oftentimes when people say different, they want to remove a hump from their nose, they want a smaller nose. But he said very specifically, I want to look like a different person. And that was our first red flag, right?
Yes. He said that I want people that know me not to recognize me anymore.
That's crazy.
And we said, we haven't heard that one before.
So he booked surgery same day, right?
Yes. So he came in for the consultation with someone else. It was so two people that came in. The other gentleman waited in the lobby. And he told the staff that that was his driver. And the patient was taken back for their consultation.
And he said he had a driver because he had just flown in from out of state for this specific consult.
Correct. And he had the consultation, and then he was on the phone during his consultation.
During the consult with the doctor, he was on the phone.
Yeah. He answered the phone while the doctor was in there. And then
Dr. J, I'm a lot easier going. Dr. J does not like that.
No. And then the doctor stepped out. And then there was the clinic staff was explaining everything to the patient of, what the next steps are and how to proceed and all of that kind of stuff. And he's like, yeah, I just want to basically book the procedure right now. And then the clinic staff member said, well, I don't do that. You have to meet with our surgical care coordinator who will then assist you with booking the procedure. And while this conversation is happening, the patient is still on the phone.
What?
He's talking in another language to someone.
What? So they couldn't figure out what he was talking about.
No, the clinic staff member didn't figure out what the patient was talking about. He just was talking another language while the clinic staff member is telling him what the next steps are, how to book this surgery.
So after the clinic person is done, the surgical coordinator goes in and gives the quote.
Correct.
And then he pays right away and books, or what happened next?
Yeah. So he asked if he could have surgery today.
Same day.
Yeah. And of course, our surgical care coordinator said, well, we don't have openings today. We don't do surgeries today, but I'm welcome to look at the next available date. And I can offer that to you. And he said, well, I have to get it done within a week to 2 weeks maximum because I'm going back where I came from and I just have to get this done right away.
Did he tell us where he was going back? Was it in the U.S. or was he going back outside the U.S.?
He was within the U.S. He was going back to the East Coast, he said.
Okay.
He has to go back to the East Coast, so he wants to get surgery right away. And, she explained to him, this is the cost of it. And because you want to get surgery within 2 weeks or within a week or two, you have to pay with either cash or you have to bring a cashier's check.
And we do that because we've had people give us bad checks.
Correct.
Right. And the checks sometimes bounce after surgery because it takes up to
7 to 14 days.
And so because of that short window, he had to give cash or a cashier check, which are guaranteed.
Correct. And he said, sure. And then she said that, well, I need a deposit in order to book your surgery. So he said, well, I don't have the deposit right now, but I can go run to the bank and give you the full amount with a cashier's check.
Same day.
Same day. And so he leaves with his driver. And then after a few hours, he comes back with the full amount on the cashier's check. And it's a legit cashier's check and it's perfect.
So it wasn't a $1,000 deposit. It was for the whole surgery.
Correct. He paid for the whole surgery with a cashier's check.
It was like a bank check.
Mm-hmm.
Which bank was it?
I'm pretty sure either it was Chase or Wells Fargo.
Oh yeah, I think it was HSBC.
Yes.
So and they don't have do they have locations in Seattle? I don't even think they do.
I don't know. Yeah, I think it was HSBC bank account, and he brought the cashier's check, paid for his surgery with that, and he was booked. He was booked for I think 4 days after or 5 days after the from that consultation date because he wanted to get a rushed surgery date.
And they made an exception to squeeze him in.
Correct.
Right?
Yes. He was really adamant with the doctor. He was really adamant with the surgical care coordinator that he had to get this done within a week. So they made an exception for him and they squeezed him in, and he said he was going to pay the full amount right away.
And this whole time, was he acting weird?
He just was very adamant that he just had to get this done right away.
You got the cashier check. Do you take it to the bank the same day or was it normal routine?
Yeah. So we booked the surgery, of course. We had to do his pre-op the same day because the surgery was so soon. And he was okay with that. He did the pre-op. We did all of that. Everything was good to go. He was scheduled and everything. I went to the bank, deposited the check, no worries at all.
Now, I remember his nurse who was there for the consult. She told me that there was a comment that was off that he made. And he told her, when I am going to sleep and waking up.
Yes, I remember
what did he say? Something?
He said to her, could you let the surgical team know that when you guys put me to sleep, that don't believe anything I say?
That's weird.
Yeah, it was really weird. He said that, I just, when I'm put to sleep, I just like say weird things. So when I'm saying stuff in my sleep, when you guys put me to sleep for the surgery, just don't believe me. Everything is just probably false information.
I've never had anyone say that, and I've done thousands of surgeries.
Yeah. So then he was scheduled for surgery. Everything was good. I went to the bank, deposited the check and everything. After about, I think it was like 24 hours after I had gone to the bank, we got a phone call. And on the phone call, it was a private investigator. They introduced himself from
like a private, like a regular person, or was it a detective?
It was a bank investigator.
Okay.
From HSBC.
Okay.
It was a man on the phone. He said, "I'm calling from HSBC Bank. I'm one of the investigators here. Could I speak to someone that handles your bank accounts?" And I spoke to one of our surgical care coordinators who had accepted the check. She actually spoke to the big guy on the phone, and she said, I was the one that helped this person to, got this check from him, and I, verified everything. Oh, another weird thing about him was he had 2 IDs, 2 different names on his IDs.
How did we catch that?
Well, we asked for ID at the pre-op, and he gave us 2 forms of ID, and the names were different. But he had said that he had name change.
Okay.
So we had deposit. So then we had that phone call, and basically the investigator on the phone said, "Are you aware of who this person is that deposited his check?" We said, "No, this is a patient here trying to get surgery." And the bank alerted us that the person had a warrant against them.
Okay, and that's all they told you, there's a warrant?
Yes, they said that there was a warrant against this person and that check is fraudulent. This person does not have this money. This person doesn't even have an account with HSBC. This was a made-up check. and that there's no money and you guys will not receive the money.
And then I remember you came to me and you were like, what do I do now?
Yes. I was like, what do we do?
Did they give us instructions what to do next, or what did the banker say too?
Yes. The banker said that you should contact your local FBI or police department in terms of this patient.
And then when we talked, I was like, let's call the police because this is weird. We're not going to let somebody get away with a crime.
Yes.
And then we called the local police first.
Correct. We called the local police.
And you called them?
Mm-hmm.
And what did you tell them?
I told them that the patient came in, they deposited a check, then we received, when I deposited a check, after that I received a call from that bank saying that this person has a warrant against them and that we should contact the local police or the FBI about this person.
Okay.
And the police said, okay, we'll be at your location in a few minutes and we're going to get a statement from you.
Then they came here in the middle of the clinic day.
Yes.
And and it was just a normal cop that came?
Yes, it was a normal cop that came. They asked us for all the information that we had about this individual. We gave them all the information and everything. And they asked about like what surgery he was getting and all that. We had to figure out what information we could give them and not give them.
And we called the lawyer and we asked the lawyer.
Correct. So we were only be told to give certain information to them. So we gave them whatever we could.
And we have to follow HIPAA, right?
Correct.
The Health Information Portability Protection Act. So when we have patients here, we can't disclose details. We have to be very strict on what we say, how we say it, and who we say it to. Correct.
So we made sure that we gave the only information that was told that we were allowed to give. And then the police, went, he gave me his card and he left. A few minutes late, a few hours later, they called us again and asked us more information. And then they asked us a picture of the check. So then I had to download it from the bank website, give them a picture of the check. I think they contacted HSBC to get information from them. And then they called us back.
Third call.
Third call. And this call was kind of scary. The investigator was now an FBI special agent that was on the phone, and he had been alerted and involved now in this situation. And basically told us that this individual has many warrants against them. They are also involved in bigger criminal activities such as terrorism. And
they said he was a terrorist.
Basically.
And he was from the Middle East.
Correct. And that this individual was involved in terrorist activities and that they're possibly doing the surgery or trying to do the surgery to change their appearance so they wouldn't get caught.
That was like a jaw-dropping moment when you told me that.
It was really scary. I couldn't believe I was talking to an FBI special agent on the phone about an individual that had just came here 2 days ago.
That's wild. I remember all the staff got super scared.
Yes, everyone was so scared. What was going to happen? What are we going to do? His surgery was the next day.
So what did the FBI say? What did they want us to do?
So the FBI and the police, the Linwood police, the Seattle, all these different forces were basically involved in this case. And they basically told us that we are not allowed to cancel the procedure.
That's nuts.
And basically the patient was under the impression that the surgery is happening. And the patient called us twice, which was 2 more red flags after that. He actually called to speak to the surgical care coordinator to ask if everything was okay with the payment.
That's weird. So what did the FBI want to do to catch him?
So basically they told us that we have to just keep it calm, act like the surgery is happening, let him know the check was okay, let him know everything is good, he's set for surgery, and have him just come like a normal patient would come. And basically they wanted to do a sting operation.
And they wanted to catch him in the lobby. I remember you coming to me and asking me if this was okay. Yes,
they wanted to catch him in our office lobby because that would be the safest way for them to confirm that they would be able to arrest him. And they didn't want to do it outside in case he was trying to run away and stuff. And I still remember till this day, the police had came 4 hours or 5 hours before this patient was going to arrive, laid out all their people. There was undercover cops throughout the entire building. There were undercover cops outside of the building. There was cops on the main street and the back street. And then we had 3 undercover cops sitting in our lobby.
Now, I remember when they said they wanted to catch him in the lobby, I said, no.
Yes.
You guys have to, I don't want to jeopardize the safety of the staff here. So
and the other patients too. Mm-hmm.
So I first said catch him in the lobby of the building, but they didn't want that because there were 2 exits.
Mm-hmm.
So then they agreed that they would let him come to our floor and they would try to catch him right when he came out of the elevator, right?
Correct. So that's why they had cops standing inside the stairwell.
So the morning of, what was the atmosphere in the office when the sting was supposed to go down?
It was everyone was super nervous. Everyone's ears, eyes, everything was open. Everyone kept looking at the window, like, when is he coming? When is he coming? When is he coming? There was 3 undercover cops sitting in our lobby with normal clothes, acting like patients.
But they didn't look like cosmetic patients.
The funny part is we had another patient and another caregiver at the same time in the building, and the caregiver was sitting inside one of the consult rooms. I remember asking the caregiver, would you like anything to drink? And the caregiver said, no, I'm okay. He's like, can I ask you something? I said, sure. He said, what's going down? And I said, what do you mean? There's nothing going down. Normal day, we're just surgery day.
Yeah, doing surgeries here, nothing else.
Doing surgery, nothing else. He's like, I know what's happening. And I was like, what do you mean? He's like, oh, close the door. And I closed the door and he's like, I'm an undercover cop. And I'm like, he's like, yeah, everyone in your lobby and outside, they all know me. I know them too. He's like, if you guys need help, I got you. I said, I think we're fine. I was like, yeah, there's someone that they want to, there's a sting. He basically knew everything because he's part of that group and he's an undercover cop himself. And he basically knew there was a sting operation happening, which was super funny.
That's so crazy.
Yeah. And then everyone's super nervous. And then I still remember everyone was looking at, like, the time was happening. It was, I think, 1 p.m. that he was supposed to arrive. And it was like 12:55. And people were looking in the window and we see a car pull up to the front of our building. There was a driver there, the same person that had came to him with a consult. His driver was driving the car. He came out of the car and he stepped into the building and the car drove away to park. And he got into the...
And I was in surgery this time.
Yes.
So I was focused on my cases. I had no idea what was going on because we have 2 operating rooms here.
Yeah.
So 2 doctors doing surgery.
Yeah. And all the other staff knew that this thing is happening and to stay calm. And there was multiple cops and undercover cops in the building. So everyone was told to stay calm. And basically he came in, he got out, he got on the 6th floor. He came out of the elevator and the undercover cops, of course, had his pictures and had the background information about him, everything. And they, within seconds, I would say within not even half a second, they all, from every angle of the of the 6th floor, there was multiple cops that came in and just arrested him on the back. And then...
Did you try to run or anything?
No. He didn't. It was really weird. We could see everything because it's clear doors, but he didn't try to fight it. He knew he was caught, basically. He didn't try to fight it. He didn't say anything. He just had a bag with him, and then he basically just dropped the bag. And then the funny part was, right after they arrested him, right outside our office, the cops are like, there's 5 cops standing there. And basically they see the elevator open and it's his driver.
What? And the guy's on the floor getting arrested.
The guy's already arrested. The guy is arrested and there's 4 cops standing there and the elevator opens and it's the driver. And right before he's about to exit, he's like hitting the button. You can hear it. That's how loudly he was. Closed door button. He was hitting it so loudly. We're like, and then you see the door close and the 3 cops ran to the stairwell. And then just after that, they like took all of those people and they left. And then
they got the runner?
Yeah. So then after that, after about like 40 minutes, another cop came and just like confirmed with us that everything is safe. We got both of them. You guys have nothing to worry about. If we need any additional information from you guys, we'll let you guys know. But we really appreciate you guys cooperating with us and helping us get this person.
That's such an incredible thing. I can't believe we were a part of some terrorist person getting arrested.
Oh my goodness. That was Wild day.
Wild. What an incredible story. What do we have in the works for our next Clinic Talk episode?
We have something called Code Brown and many more to come.
Join us for the next Clinic Talk episode where we talk about Code Brown. Catch us on all social media and watch me do surgery live on Snapchat at realdrseattle. Bam, what?